say who you are and what your role is?
I'm Pat McGorry. I'm Professor of Youth Mental Health at the University of Melbourne and Director of Origin Youth Health.
Okay, Pat, so what sort of messages do you think we should be giving to commissioners? Just a couple of key messages for commissioners about why early intervention is a good idea.
Well, early intervention's got obvious, face value and just on the human level. And it's now the most evidence-based reform strategy in the mental health arena. It's got 15 years of accumulative evidence behind it. It's really taking shape in many parts of the world. And it's a big principle in mental health. It's not just early intervention psychosis that's at stake here. It's proper, timely care for all people in the early stages of illness. It's the same principle as in other parts of health, in cardiovascular medicine and cancer and other areas. And we're now showing that that's also true in mental health. So we've got to extend it. And it particularly means a focus on young people, because the main onset period for potentially serious mental disorders is in teenagers and young adults. So there's a lot at stake here. It's really given a very optimistic future to growth and investment in mental health.
And so, what's it like for a youngster who's coming into your service now compared to a youngster who doesn't have access to your service? What do you think are the two or three big things that they would notice that were different?
Well, I think the first thing is the culture of the service. It's friendly towards young people and families. Our staff tend to be younger and more tuned in, and certainly more sympathetic and sensitive to young people's issues. We've got youth participation operating, so that it's got a feel, a young feel to it, so people can engage. And the other key thing is there's real expertise in working with young people, and it's a clinical research culture, so we're always learning and trying to develop new ways of working and evaluating them. So it's a healthy organisation, and you can feel it when you walk into it.
And in terms of families, what do families sense that's different in your sort of youth early intervention service?
Well, families are critical, at all stages, but obviously particularly for teenagers and young adults who are developmentally trying to make this sort of transition to adulthood, and that involves, a degree of increasing separation from the family and independence. And if people are unwell or ill at that time, it obviously makes it much more complicated. So you've got to be working with families and involving them and helping them deal with the kind of stresses and traumas of the whole process too. And we try to do that. We could do better, but I think it's something that everyone's committed to.
So in the UK at the moment, we've got some financial issues that we're dealing with, and there may be pressure on services to demonstrate their effectiveness. Do you think there are any key messages that commissioners can take away, where they can be confident that early intervention will help them to sort of weather a crisis of finance?
Well, actually, early intervention is one of the solutions they could turn to, because it's actually economically irresponsible not to fund early intervention services, because over a 7-year follow-up period, patients cost about a third as much if they've been exposed to early intervention over that period. So if they're not doing early intervention, they're wasting precious public money.
And how's that money being spent differently then? You say you're saving a third. What does that mean? How does that translate into savings?
Well, first of all, people get access earlier, so they're more easily treatable. There's not as much damage and repair work to be done. And secondly, we're guaranteeing tenure of care in that critical first couple of years, probably even longer really, but we're guaranteeing that quality of care, and it pays off because they need a lot less input over the succeeding years as a result. So it's really a no-brainer in terms of investment.
And where do you think it's going? In 5 or 10 years' time, when we come back, where do you think we'll have got to?
Well, hopefully we'll see early intervention firmly established as a pillar of clinical care in psychiatry, just like it is in other specialties, other areas of healthcare. And secondly, we'll have a new sort of tier, a new stream of care around the teenage and young adult period, which currently doesn't exist. It's a huge missing element in our system, and we've currently got CAMs and adults, and there's this missing bit, and I'd like to see that really built over the next 10 years.
Fantastic. Thank you very much.
Great, thanks.